Tired of constant back pain but not sure if spine surgery can help? Today, you'll meet Dr. Hans, a board-certified orthopedic surgeon in Tijuana. He's here to break down the three most common spine surgeries. Let's get into it.
What are the spine surgeries you do, what exactly they mean, and how do you do that? Maybe the problems you can show in this model, please.
The spine is a very common source of pain in the body. Maybe someday we feel pain in the neck, feel pain in the back. Maybe sometimes we feel pain in the sciatic nerve. So it's very common. That pain can be produced for an attrition or damage in the disc. In this part between the bones, we have a disc. The disc have a tissue that is more or less soft in some parts. We have a ring in the outside, and in the middle we have like a gel. With that we can do this move when we stand up, when we carry weight, when we move. That's why, because the spine have a lot of joints. So we have different treatments. If the damage is a little high, if the process continue and the patient have damage in the disc, that the disc is herniating, maybe level 2, level 3, we can make another kind of treatment.
What is herniating? What does herniation mean?
In this part, in the posterior part, the disc go out and compress the nerve. That's mean when I say that the disc is herniated, is because the disc go out and compress
Compress this.
Yeah. Loses the nerve. The herniated disc is in the neck. The pain go to the back, the shoulder, and can travel to the hands. If the herniated disc is in the lower back, the lumbar part, the pain can go back to the hip and to the foot. Okay. So depending in the level of the spine, we can make the treatment. Treatment is the nervation. We can damage the nerves, the pain nerves, to stop the pain. And we can use a needle to introduce in the disc. With that, the disc goes smaller. We can make it smaller. So with that, the herniated disc is gonna decrease the size. And with that, we eliminate the compression of the nerve.
What is that procedure called of the needles that you use?
The name is rhizolysis, the nervation of nerve with hot.
Nervation of the nerve with warm, hot. Okay.
Warm hot.
Okay. So that's one procedure you do.
Yeah.
Okay.
And all of that is made only with needles. We don't have to open the wound. It's not a surgery. It's ambulatory process. You can come one day and you can go home the same day.
Okay.
You can walk after surgery. And with that warm we use to damage the nerves, is gonna last for 6 months to 1 year. Even some patients feel good for 2.5 years or 7 years, depending the level of damage of the disc. In some patients, the disc can be herniated and they go out of the ring. If the ring is damaged and broken, the interior side of the disc can travel to the posterior side and can compress the nerve. So with that, we have a lot of pain in the back and a lot of pain in the leg. If the herniated disc is in the right side, we will feel pain in the back and in the right leg. If we feel pain in the left, that means that the problem is in the left side of the disc.
Mm-hmm.
So we have a surgery that is minimal invasive. Minimal invasive means that we can do a surgery that even can be as smaller as 1 centimeter. Okay, with that we can introduce a very small lens to see the disc directly. We have to remove the herniated disc, only that part, not all the disc, to avoid the compression of the nerve, and with that we can stop the sciatic pain.
So in this surgery, how many days is the patient hospitalized? Just one night?
Yes, 1 night. For this surgery, the patients arrive to the hospital early in the morning, fasting. We take test blood, chest, X-ray. We can make a valorization of the risk. After that, we can do the surgery, and the patient on the next day can go home. If everything is okay after he walk and he feel that the pain's gone,
So they can fly back home the following day?
yes, the following day. With the scar is like this. It's very small.
And do they need recovery time?
The recovery time, I really try to explain to the patient that after we remove the herniated disc, the disc have to be healed, and that takes 6 weeks after the surgery. The patient have to avoid carry weight and do exercises with impact like running, jumping, and workout. 6 weeks have to avoid it. If the patient have a lot of movement because the joints are damaged and the ligaments are not working as well, or the space between the bones is very, very small, we have to make a surgery to stabilize all the joints. So we have to use screws to put it in the bone, some titanium bars to create an stabilization in the back. Even we can change all the disc for a new one implant. With that, we can stop the pain.
So the stabilization process is called spinal fusion.
Yeah. Spinal fusion is a surgery when we have to change all the disc and change it for an implant to make a fusion between this bone to the other bone. And in the posterior side, we can use some screws to fusion the posterior side. With that, we can stop moving the vertebrae and we can eliminate the pain. Spinal fusion is made in patients that segment of the spine have a lot of movements. If the movement of this segment of the spine are causing the pain, we have to make the spine fusion. We can determine if the patient needs that surgery, making special x-rays with movement, dynamic x-rays of the spine. When the patient flex a lot and extend a lot, and with that we can determine if this bone is moving a lot. If the spine is moving a lot, we have to make the spinal fusion.
Curious about other affordable orthopedic procedures in Tijuana? Check out our full guide here.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.